Well, we're very fortunate to have Dr. Kevin Kavanagh, who is with us through this pandemic, and he is he's a retired physician, first of all, but he is also the founder of Health Watch USA, a nationwide organization. Good morning to you, Dr. Kavanagh.
Oh, good morning, Jack.
We were talking about this the other day, and I see this morning that the CDC is considering recommending the general public wear face coverings in public. They haven't actually made that recommendation yet, right?
Well, they have not made it yet, but do believe that is how things are going. As you know, we've talked about this now for the last 2 weeks. This is what's been used very successfully in Southeastern Asia. And as we've stressed, it may not protect you from getting the virus, but if you are an asymptomatic carrier, which so many people are, unfortunately, it will help to protect others. And it will also keep you from touching your nose and mouth unconsciously, which is a huge mechanism of spread. So even the cloth masks, which are self-made, may help some.
There was a story a couple of days ago that I just couldn't believe. There was an LA Times story about 60 people that got the COVID-19 from attending a choir rehearsal. And as I understand, that has given us a little bit different look about how this disease is transmitted, right?
Well, yes, there may be some aerosolization of the virus, especially when a lot of people are in very close quarters and they're doing things such as singing at a high volume. But in general, it's not felt to be a primary driver. Unfortunately, things are changing quite rapidly with this epidemic as far as guidance goes. So the best thing to do right now is to socially isolate, to stay at home. If you want to call it shelter in place, do that. Only get groceries about once a week, preferably have them delivered to your house. As I said before, we're even going to the extent of having them delivered to our garage, non-perishables, and letting them sit for 3 days before bringing them into the house.
Has the CDC learned anything new about the virus, such as how contagious it is or how it's transmitted just in the last recent weeks?
Well, yes, and unfortunately, it's been all depressing. If anybody listened to the president's news briefing yesterday, the tone was entirely different.
Yeah, it was.
He stated, it is not the flu. It is vicious. And if we do nothing, 2.2 million people could succumb to this disease. But we're not doing nothing. We are doing something. But even if we do that, we're looking at between 100 to 200,000 people that may die in the United States. And that's with social isolation up to the end of May, not April, but May. That's what those models are based upon. And we still have states such as Pennsylvania, Florida, and Texas, which are not socially isolating to the point of staying at home. Our governor has been ahead of the curve on this, and we're one of the states, if you look at the maps, that are still lightly colored, and that's thanks to our governor. But what we do not want to have happen is that we go through this commitment and really this ordeal of staying at home, and then have another state which is not doing it come into our state and contaminate again our society and bring the virus back into us. And this is why a national policy is needed so desperately. So we need to get that in order to really get a handle on this epidemic.
Is this something that you think the Trump administration is going to have to step in and make a federal order?
Well, I think that they may have to. But, you know, all of the news media pressure on President Trump is sometimes counterproductive. God forbid if he called out the military or he did these type of orders, I'm sure he's scared he'll be accused of trying to be a dictator. But nevertheless, we need to have strong federal government, and we need to stop focusing on partisan issues and focusing on getting us through this epidemic. That's what's of utmost importance. It was said that this is 3 times as infectious as the flu. So that would be an R naught of 4, which is very infectious. So please stay at home, and social distancing is important.
U.S. government gave its first official projection of the potential toll from the virus, from the pandemic. The experts now projecting between 100,000 and 240,000 deaths, and that's with social distancing, bringing the numbers down. Dr. Birx, coordinator of the White House's coronavirus task force, says, quote, There's no magic bullet. There's no magic vaccine or therapy. It's just behaviors. Each of our behaviors translating into something that changes the course of the viral pandemic over the next 30 days.
And that is correct. The only caveat there is that my understanding is those models are based upon till the end of May. As I stated several weeks ago, when you asked me, are we looking at a few weeks in isolation, I said, no, I think we're looking at a few months of socially isolating. So this is not, to me, surprising. And I know that we've both been accused of being alarmist, but if your neighbor's house is on fire, it's time to pack up your stuff and get organized in your house because you have to take precautions.
I understand that ibuprofen, which was originally thought to be harmful, they found it is okay for people to take with coronavirus. Is that right?
That's what I am hearing, and I have been following that. They cannot find reliable laboratory evidence or reliable evidence that's with people or epidemiological evidence which indicates that that could be a danger. So it is very confusing, and that's one of the confusing things about the internet is that you hear so much coming across, and some of these are from reputable sources because you don't have time for double-blind studies. When you're caught off guard, there is a lot of confusion, such as the confusion or fog of war, and this is very similar to a war.
We hear a lot about PPE, the personal protection devices or equipment. Is that situation getting any better?
I think it's getting a little bit better, or at least will get a little bit better in the near future. They are bringing online a device which can sterilize masks, allowing them to be reused, and this will help out, I think, immensely. I think that if the public starts wearing at least some facial protection, and preferably not the protection that the healthcare workers need, because they need it, they're number one.
Right.
And unless that equipment's worn properly, it won't do much good, and you don't want to give yourself a false sense of security. But doing social distancing, increasing your social distancing and wearing some PPE may well help slow down the spread of the virus and the need for this type of equipment. Also very important, do not go into your healthcare system with minor flus and sniffles, because if you do that with minor symptoms, you'll be using up a PPE for that worker to evaluate you. And now we're getting more and more evidence, because we have asymptomatic carriers, that PPEs maybe should be worn evaluating everyone, because we have to preserve our healthcare workers. So it is becoming critical, but I do think there is some light at the end of the tunnel as far as availability of PPEs, and hopefully in a couple of weeks that will become available. And that's one of the reasons why we want to postpone the peak of this curve so our healthcare system can get up and running and ready for this pandemic.
Dr. Kevin Kavanagh, we're very thankful for you and glad that you have spent so much time with us. We'll talk to you again on Friday.
Thank you very much, Jack.
Dr. Kevin Kavanagh is the founder of Health Watch USA, a national organization, and a retired physician.